What is the state of your health? Do you have a case of male or female infertility? Have you been told you have a low sperm count? Do you have a prostate problem? Are you a lady suffering from abnormal menstrual problems? Never worry again. Zoe Fertility and Alternative Medical Center has all the answers to your health needs. At Zoe, we treat all kinds of health problems, including erectile dysfunction. Zoe Fertility Center has a state-of-the-art laboratory and an ultrasound scan services available. There's also the total body scan, which scans all your organs in 5 minutes. Yes, you heard right, in 5 minutes. Our pharmacy is well stocked with good and highly efficacious natural medicines, all without side effects. Locate Zoe Fertility and Alternative Medical Center at our Adenta new site, behind the CAF International School, opposite Mechanical Lloyd on the Adenta Ebri Road. At Odoko, we are near Nicolisi Hotel, behind International Needs. Odoko Terrazzo. Call 0205 363614 or 0243 239534. Zoe Fertility and Alternative Medical Center, excellent healthcare, our hallmark.
Hello, dear friends. Welcome to the Zoe Health Talk Show. The Zoe Health Talk Show is a health education program which comes your way every week. My name is Dr. Fiao from the Zoe Fertility and Alternative Medical Center. Today, I want to talk about abnormal uterine bleeding. Abnormal uterine bleeding. Any bleeding from the uterus which is not normal is abnormal uterine bleeding. Is different from your menstruation. What it means is that when a lady has bleeding that is coming from the uterus, but that is not related to her menses, and then also it comes in an abnormal quantity or amount, that is a case of abnormal uterine bleeding. Now, the features of abnormal uterine bleeding has to do with a heavy menstrual flow. A heavy menstrual flow that sometimes comes with clots and all that. Secondly, when there is prolonged bleeding, which is not ceasing or is not stopping. And so, normal menstruation ranges from 2 to 7 days. But when a woman is having bleeding from the uterus, which comes for more than 7 days, sometimes 10 days, sometimes 2 weeks, or sometimes a whole month, a woman is bleeding, that is a case of abnormal uterine bleeding. There is also a case where some do not have heavy bleeding, but they have scanty bleeding. So you have this scanty blood spots, vaginal bleeding that comes, and it comes and it's not stopping. It comes like you bleed for some 2-3 days, and then it stops for a day or two, and then you start to bleed again, but in a scanty amount for another 7 days, and then it will stop. So you have this prolonged bleeding, but it comes in scanty amounts. That's also is a feature of abnormal uterine bleeding. The other feature that goes with abnormal uterine bleeding is painful lower abdomen. Sometimes some will complain that when they have heavy menstrual flow or heavy vaginal bleeding, which is not ceasing, they have also pains in the lower abdomen. And sometimes these pains can spread to the waist or to the thigh and all that. Sometimes it becomes difficult for them to be able to live their normal everyday, do their normal everyday activities and all that. There are various causes of abnormal uterine bleeding in women. There are various causes. One has to do with when there is a structural problem of the uterus. A structural problem of the uterus. The uterus is the womb, and it is what carries pregnancy, the fetus, and all that. But sometimes you can have abnormal growths within the uterus, like uterine fibroids, enlarging uterine fibroids, or degenerating uterine fibroids. When you have something like that, depending on the the location of the fibroids, the size of the fibroids, and all that, one of the complications that you have is abnormal uterine bleeding. Sometimes you can have bleeding that will come heavily, and you will change parts several times. And what happens is that when you bleed heavily for a long time, then it leads to severe anemia. And when that happens, then you realize that you feel dizzy sometimes, you feel tired easily, your ability to concentrate and all that lowers, and all that. So, and when there is structural abnormality of the uterus, where there is abnormal growths like uterine fibroids and all that, you can have abnormal uterine bleeding. There is also the condition of uterine polyps. These are small growths that can grow within the endometrium or the inside of the uterus, and that can also lead to abnormal uterine bleeding. There is also another condition we call endometriosis. Endometriosis, and this is when you have the growth of tissues that normally line within the uterus, growing outside the uterus. When you take the uterus, there are tissues that line inside the uterus, which proliferate or multiply with time in the course of the menstrual cycle. And then at the end of the cycle, when you have to menstruate, everything sloughs off or breaks off, and then you have your menses. But sometimes you can have these tissues developing outside the uterus, and then they increase in number. And sometimes when you have these things present, it leads to abnormal uterine bleeding, where you can have heavy menstrual bleeding with pains in the abdomen, the lower abdomen, waist pains, and all that. So that's something that we must take note of. There are those who have problems in the ovaries. For example, when a woman has polycystic ovaries, sometimes what happens with polycystic ovaries is that their menses can cease for a period. So sometimes they can go for several months without seeing their menses, like 3, 4, 5, 6 months. They don't see their menses. And then when they start to have their menses, because for a long time they have not had their menses, they bleed heavily. And sometimes this bleeding doesn't stop unless they go to the hospital to be seen by a doctor for certain medication to be administered, and then the bleeding can be stopped. And so problems with the ovaries, like polycystic ovaries and all that, can also lead to abnormal uterine bleeding. So that is something that we must also take note of, and all that. There are instances where when you have infections like pelvic inflammatory disease, that can also cause abnormal uterine bleeding. Pelvic inflammatory disease is when you have an infection of the upper part of the uterus. So an infection of the fallopian tubes or infection of the cervix and all that sometimes can lead to abnormal uterine bleeding and cause problems. And so women have to be careful the way they handle themselves in terms of exposing themselves and all that, because sometimes if you're not careful, you end up getting infections through certain lifestyle behaviors. For example, when a woman visits the washroom and you have to clean yourself, normally you have to clean yourself from the front to the back, not from the back to the front. What it means is that if you're not careful and you clean yourself from the back, from the anus to the vaginal area, you are likely to transfer microorganisms from the anus to the vagina. And this can cause an infection which can travel up the reproductive tract and affect the fallopian tubes and the uterus. And that can lead to abnormal uterine bleeding. So let's take note of this. There are women who have abnormal uterine bleeding because they are on certain medications, especially the contraceptives. When you are on contraceptive medications and all that, sometimes the side effects of these medications can lead to abnormal uterine bleeding. So the oral contraceptive pills, the other contraceptive medications and all that can lead to abnormal uterine bleeding. But when you have a case like that and you present at the hospital, an investigation will be done to find out the cause, and then treatment can be given you. Thank you so much. Our time is up. We'll come your way again. Until then, live a healthy life. Bye-bye.
What is the state of your health? Do you have a case of male or female infertility? Have you been told you have a low sperm count? Do you have a prostate problem? Are you a lady suffering from abnormal menstrual problems? Never worry again. Zoe Fertility and Alternative Medical Center has all the answers to your health needs. At Zoe, we treat all kinds of health problems, including erectile dysfunction. Zoe Fertility Center has a state-of-the-art laboratory and an ultrasound scan services available. There's also the total body scan, which scans all your organs in 5 minutes. Yes, you heard right, in 5 minutes. Our pharmacy is well stocked with good and highly efficacious natural medicines, all without side effects. Locate Zoe Fertility and Alternative Medical Center at our Denton New site, behind the CAF International School, opposite Mechanical Lloyd on the Adenta Ebri Road. At Odoko, we are near Nicolisi Hotel, behind International Needs. Odoko Terrazzo. Call 0205 363614 or 0243 239534. Zoe Fertility and Alternative Medical Center, excellent healthcare, our hallmark.